The Ascension Parish Mental Health and Addictive Disorder Board is called to order. The minutes show that all members are present. And tonight we start on the 57th year of an Ascension Parish volunteer board members, mental health board members.
Congratulations.
Thank you. Second on the agenda is approval of the minutes for December the 20th.
I'll make a motion to approve the minutes for December 20th, 2007.
Second.
Any objections? Stand as approved. No 2/3 vote. Celeste, nothing? Thank you. Public comments, none. Status report, Mr. Ryan, for the state.
Good evening.
Good evening.
I passed out the statistics from December. If you have any questions, I'll be happy to answer them. If not, I just have a few things I want to talk about. One is, within the last few weeks, we've started our new admissions process. And so all the people who are coming in for new admissions now go through orientation. They see a social worker, and they see a physician, a psychiatrist on the same day. So we've streamlined the process so that people who come in will get all of their services provided that one day where they get their medications and they can walk out the door and have another appointment to come in or a referral, but we've worked it out. It took us a little while, but now everybody can come in and see the social worker and doctor and get everything done on the same day.
That is absolutely fabulous. I don't know how y'all accomplished it, but that's great.
So we've done it for 2 weeks now, and everything's gone pretty well. So,
Great.
you know, we have our glitches, but we're working those out, and it seems to work well. I had a number of clients tell me today that they were really appreciative of it because they, you know, normally they have to wait months to get in, and then they have to wait months to see the doctor, and we're getting people in and out. Right now, it's about 2-week wait for us. So.
That's great.
And the other thing that I want to talk about is that we're fully staffed. We hired our new social worker, and so now we have all our social worker positions, clerical positions, doctors, nurses, everybody's filled. So we're glad to be fully staffed, and we're ready to take on all the new clients. So,
Okay.
any questions for me? All right.
Ms. Ryan, do you participate in that situation of getting all this done and being fully staffed?
Do I participate
You participate in that?
Yes, I participate.
We would like to say thanks to you and everyone who is
Outstanding.
involved.
All right. Thank you.
Status report, Ascension Parish, Ms. Dr. Susan Menendoff.
Thank you. First, I'd like to look at the statistics. We served 786. We provide 786 services in the month of December. 1,023 appointments were made. That's 128 more than last year, and 191 services more provided. We screened 115 calls, and you'll see the breakdown of those services on the first page. We provided 13 individual sessions and 2 groups in Donaldsonville. I'd like to also look at the annual statistics that I gave you. 12,262 appointments were made in 2007, and 10,467 were kept, with a kept rate of 85%, which is very, very good, and a great increase from the 60% we were running 3 years ago. So we're very pleased about that. If you look, this annual statistics page looks fairly intimidating, but it's just a breakdown of all the categories that you get every month. So it's the same thing I report to you every month, just put all together on the same page so you can track it month by month. And when you evaluate December statistics, please keep in mind that staff were on vacation, and clients are on vacation. So there's always a drop there. Clinic collections in 2007, $2,552. December of 2006, $2,713. And December of 2005, $6,898. Under personnel, one of our adolescent substance abuse counselors resigned effective today. Actually, she resigned 2 weeks ago, and today is her last day. So what we plan to do is consolidate that position with the other adolescent substance abuse counselor. We didn't have quite enough work for the two positions. That's not the reason she resigned. But we're able to consolidate those functions under one adolescent substance abuse counselor. And the adolescent substance abuse counselor will be assisted by the juvenile drug diversion coordinator from the DA's agreement that you all approve every month. That's Trinice Landry. She will assist with the groups in the school. And we have a new licensed professional counselor intern from LSU's graduate program, and she's also going to assist Trinice with the groups at the school. So the remaining adolescent counselor will be in charge of the program, and she'll be assisted by those two people. And our plan, we haven't quite made a decision on this, but my thoughts are that we probably will change that position to a mental health counselor position. We've really built up our mental health caseload, and our substance abuse caseload has stayed about the same. So we have adequate staff for one, not enough staff for the mental health counselor position. We have, I'm going to report under grants that we haven't heard anything from the hospital board yet about the funding, so we don't want to make many changes until we find out what they're going to do at their board meeting. So do you have any questions about personnel?
The only thing about the Ascension Hospital, you said they haven't made a decision. They started last August wanting one, and now we still don't know.
Don't know. I called yesterday again. They postponed their board meeting. Usually it occurs on the Tuesday before our meeting. They're going to have it on the 24th. So as soon as I know anything, I'll let you know. And grants, we really have no report. Just the only report I have is under the hospital board to say that we haven't heard anything from them. Under facility projects, we have are in the process of getting bids for painting the 2 clinic waiting rooms, and we are waiting to have the roof leaks repaired in Donaldsonville. So that's where we are with that.
Who okayed to put out bids for that? I know we
President
didn't.
Hughes did.
Who?
President Ronnie Hughes.
So it wasn't brought to this board. It went.
It
straight
was
to,
brought to the board. Yeah.
And what did we say?
You said you didn't want to do it, so I took it to the president, and he said to do it.
I don't think he can do that.
He can't do that.
Well, you all can take that up with him.
Well, you took it up with him. He can't do it.
Okay. Well, he thinks he can, and he did, and you can take it up with Tommy Martinez. If
So
you
I understand. I see why you got painting of Donaldsonville and Gonzales. Okay. I guess you put Donaldsonville in there because Gonzales need painting.
They both need painting. If you go back and look at the minutes, you'll see that you fussed at me quite a lot. That
Right. I'm just not
waiting
trying to
room
figure out
wasn't
you just
painted.
not realizing Donaldsonville needed painting. I'm
No,
puzzled.
no, we've been asking for months, and you keep saying no, so we.
Well, you know what the reasoning was, so we're not going to get into that.
That's good. Okay. Is there any other question you'd like? Before?
Yes, Susan, if this board is to do a budget, and we're to prove everything, and we're responsible for the funds, how can you bypass this board and go to the parish president with it?
You can
Now,
talk to the parish president about
No,
that.
ma'am, Susan.
He came to talk to you, and he told you very clearly that he wanted these projects taken care of.
No, he
They were
didn't.
budgeted for, in the 2007 budget. We lost most of our money for facility projects because you all delayed it and wouldn't give us approval.
We don't
No.
lose any money. It
Yes,
goes-
we do. It goes back into the fund, but it's not available for facility projects, so we have to.
It goes back into
we
the
were
mental
able-
health funds.
We were able to encumber some of the money for the painting projects. That's all. The rest of
Well,
it.
my thing
Oh,
is, you
excuse
just,
me, Jared. My thing was, we tried so hard to get along and to follow the rules and to follow the regulations, and we have an ordinance to follow. We have ethics board rules to follow. I didn't want any of this. I tried so hard not to get in consultation with you over what the ordinance states. We've gone to the DA, and now I really and truly do not know where and how to go to abide by the ordinance that was passed by the council and approved by the taxpayers of Ascension Parish. And I'm not trying to say that you're trying to misappropriate funds or what you're trying to do, but you are violating the budget and the ordinance and the taxpayers' thing when you bypass this board. And this board has been in operation 57 years. And this is the first time in the 57 years that any mental health director has walked over this board and went somewhere else to get permission to do something. And I feel that there is something bad wrong when we can't abide by the laws.
Are there any other questions?
yeah. And to backtrack what our chairman said, it's not that, and I want you to understand, it's not that we don't want these things done. It's the way it's done. It's how it's done. It's the respect of the matter. By looking at this, what you have on this paper here, it's like we wasting our time here, the whole board. Okay, I mean, because if we make a decision on doing something and say this is the way it's going to be done, we don't have no problem upgrading Gonzales or upgrading Downsville. That's what I want to do. But it's the appropriate way on how you do things, and it's wrong. Because we told you months and months ago that we was going to put it. We even formed a committee me and Brian, trying to get these projects going. And now we're going to get a bill back from somebody that went out and had estimates and what's not, and you're going to want us to approve it. Now, what's supposed to happen if we don't approve it? If you bring the bills back and say this is what needs to be done to pay the guys that came in to do the bidding, which is what, $50 an hour they charge now? I think it is, they say. Okay, now suppose we don't vote for that. Then who's supposed to pay it? Mental health, right? Okay, that's my point. If we didn't approve it, then why do we have to pay for it? I think whoever approved it should pay for it. If
Any
it's
other
mental health
questions?
funds, if it's mental health funds and it's taxpayers' money, you can't spend taxpayers' money at will when you want to spend it. Okay? And if we do not approve it, then we shouldn't have to pay for it. Whoever approve it, let him pay for it. If Ronnie Hughes approve it, get him back on the phone. You need to pay for this. I mean, that's just my opinion. Okay, we don't have a problem doing it, but it's the way how you do it. I mean, you disrespected us as a board by going over our head, going to the parish president to get this done. I mean, it's minor things. I know I'm a true believer. He have 1,010,000 tons to worry about than to worry about painting a building that something could be done that small. That's all I have to say.
Miss Susan, has the painting projects begun in Donaldsonville and Gonzales?
Not yet. We're taking bids.
Okay, has the repairs begun?
Which repairs?
Item B, under facilities project, repairs to the leak in the roof.
It hasn't happened yet.
It's actually been approved by Finance today, but that agenda item I did speak with Ms. Italia about. There was water coming down the walls.
Now that we did approve that.
Yes, we
Last
did.
month we spoke about that.
We did approve
it
that.
last month.
Because we had a question coming about the inspector came around and we had to pay $1,200 for him just to inspect a roof, which it could have happened after the fact, but we did approve that. But And another thing, why paint the building and the roof ain't fixed? That's spending double
We're only
money.
painting the waiting room. There's no leak in
It
the
doesn't
waiting
matter.
room.
It doesn't matter. I mean, if you go and paint the waiting area and they're repairing the roof, then a month later you got a leak coming in that you got to paint again.
The leak's in an entirely different part of the clinic.
Well, like I said, you do what you want to do. So
Okay, to finish my question, are there any other items that was on the list being taken care of at this time?
Off the top of my head, I don't know, but yes, I'm sure.
we really don't know what's going on. To be honest with you, we know the day of the meeting. We know.
Okay, could you possibly do a check and then give us an update on what is really being done and what's
be glad to
not being
do that.
done, so we can take care of what needs to be taken care of?
It's just
Thank you.
essentially the same list I've been bringing you since, I think, August. I'll be glad to do that. Any other questions? Thank you.
And we need to approve the DA's invoice.
I make a motion to approve the DA's invoice.
Second?
Budget, Ms. Celeste. I'm sorry. Anybody got any objections on paying the DA? Passes. Excuse me.
I've included in your budget packets, in your board packets, the budget reports for December. Again, if y'all have any questions or comments, just please feel free to call me.
We're staying in budget on pretty well everything.
Yes, ma'am.
Thank you. Anybody have any old business? We didn't do any discussion on the needs assessment. Didn't come up tonight. We didn't. Put any of that into that bill for the Ascension Parish Hospital. Remember when we talked about that and she made that proposal and you offered those suggestions?
Yeah, I do. I saw in the minutes where none of that was included.
Well, that was my understanding. Okay.
Might I ask, Ms. Susan, are you working on anything with the needs assessment?
Not at the moment.
Okay.
Anything under new business? Somebody like to make a motion to adjourn?
I'll make a motion that we adjourn.
I second.
This meeting has been adjourned.